Thank you very much for attending the meeting today. We're going to move forward with pricing pollution in the operating room panel. I'll just give a very brief history of what we're talking about. I think everyone in this room has some idea. Basically, as everyone knows here, the World Health Organization has identified climate change as the greatest threat to global health in the 21st century. Climate change from healthcare is becoming a much more known phenomena, or a greater percentage than we thought in the past. And years ago, Meds Sans Frontières, the Canadian Medical Association, the Lancet, and multiple organizations asked all physicians to look within our own practices and see what we could do to reduce climate change, because we realized that in general, climate change with respect to healthcare was being ignored by politicians. And often politicians are very afraid to dabble into our healthcare sector. So they said, before the politicians get going with this, look within your own workplace and see what you can do. At that point, actually, I did look into my own workplace as an anesthesiologist, and I was shocked to find out that gases I was using every day to keep people asleep were actually extremely potent greenhouse gases. We've got this word out, and thankfully, brilliant people like Dr. Anita Rao, who I'm going to allow to speak in a few minutes, have spread this word and gotten it to politicians and many other people. And I'd love for her to give you a presentation that she has also given to politicians. And with that, I'll give it over to Anita.
Thanks very much. My name's Anita Rao. I'm an anesthesiologist in Mississauga, Ontario, and I'll give you a brief overview of anesthetic gases and why we're pushing to have carbon pricing on these very potent greenhouse gases. Some of you may know this because CCL has done tremendous work in this area, and I thank CCL and Kathy Orlando for both working on this issue and also for giving me the opportunity to speak this afternoon. So anesthetic gases are used by professionals to keep a patient asleep and unconscious during surgery. They are administered continuously to a patient through a breathing tube. And at the end of the operation, they're exhaled by the patient, collected in a tube from the patient, and directed directly into the atmosphere unchanged, just like a smokestack does with pollution. In North America, anesthetic gases are the primary source of operating room emissions. Operating rooms are the most energy intensive and resource intensive areas of a hospital. And in fact, in North America, anesthetic gases comprise 5% of all of the carbon emissions from hospitals, which they themselves contribute to 4.6% of all the greenhouse gases in Canada. They are hydrofluorocarbons that are greenhouse gases that are magnitudes worse than CO2. And in fact, hydrofluorocarbons, as you all know, in other industries are subject to carbon pricing, but they have been exempt for anesthetic gases. The worst gas for the environment is called desflurane and has a global warming potential of over 2,500. I don't know how to use my own. There we go, I'm sorry. So to give you an idea in easier terms to understand, 1 hour of an anesthetic with the least polluting gas, which is the yellow one at the very top called sevoflurane, is only 6.5 kilometers driving in a sedan. Desflurane is 320 kilometers. So you can imagine by multiplying that by a 7-hour day, 5 to 7 days per week across Canada, how much pollution that really is. So we have made some efforts to restrict desflurane, as they have been in many jurisdictions in both Canada and around the world. Several best practice guidelines and position statements from the prestigious American Anesthesia, the American Society of Anesthesiologists, the World Federation of Anesthesiologists, and most recently, the Ontario's anesthesiologists have also supported restricting these high global warming potential anesthetic gases. Several health systems, including the NHS, do not carry desflurane for both environmental and financial reasons. And lobbying efforts by anesthesia professionals and by citizens, including CCL, to include anesthetic gases into the GHG inventory as Scope 1 emissions. To give you an example, and there's several examples in Ontario, and Sudbury Health Sciences North was the first to get rid of desflurane in their health system. But at mine in 2019, we used about half desflurane, half sevoflurane for all of our operations, and we emitted 441 tons of carbon. 96% of that was from one gas alone. That's 740 round trip flights from Toronto to London. If sevoflurane had completely replaced desflurane, our emissions would have been 28 tons or a 16-fold reduction. Costs would have also decreased by 30%. So we directly, in my institution of 17 anesthesiologists, melted the equivalent of a 6-lane swimming pool of summer ice. So this is the Sudbury Health Sciences North, and this study has been published in our Canadian Journal of Anesthesia, where in 2016, 57% of desflurane was used, and with targeted efforts with education and removing it from the hospital in 2019, it was eliminated from Sudbury Health Sciences Center. They decreased their carbon load by 720 tons, and they saved $45,000. From this study, we know in 2020 dollars that a bottle of sevoflurane, if there was carbon pricing put on it by either the manufacturer or the administrator, would be at $1.50 approximately. It would be 27 cents, $27 for desflurane. And in 2030, that would also increase to $151 for a bottle of desflurane, which is more than the product costs itself now. So des is really quite unsustainable. And for that reason, we are lobbying MPs to get anesthetic gases into the scope 1 for greenhouse gas inventory in order to even put a theoretical carbon price on it. We are asking our colleagues and working directly with them to limit their use. I will note that desflurane actually has no benefit to the patient compared to sevoflurane, and that's a really important point in all of this. It really is just about practice patterns and what people are used to using. There are multiple studies that do not show meaningful patient outcomes. And if you are talking to your MPs, I'm very happy to send you those studies with highlighted sections that you can quickly just say where the outcomes are not improved with desflurane. It is more costly and at least 20 times the global warming potential of sevoflurane. I believe this is more of an information session, and I'm certainly happy, and so is Dr. Mathur, to answer any questions that you have.
Are there questions in the chat? Go ahead. Yeah, I don't see a question here. There's some people in person who want to ask a question. Anita, I'll give 1 sec. Okay.
So if we wanted to, as CCO people, extend lobbying beyond just our MPs, but more towards like, I guess healthcare is provincial, but like the different health authorities or the hospital administration, so that they can administratively remove desflurane like you did in Sudbury North. How would we best do that?
I think that's an excellent question. I would say that across Canada, there's always 1 or 2 people in every department like me and Dr. Mathur working to get rid of desflurane in our health systems. The issue is how long and inefficient that process is. So it took 3 years at Sudbury Health Sciences Center, 3 years at St. Joseph's, 3 years at my center. And it's a very gradual process. And the climate crisis really does not have the time for that. We need something more urgent. So we are trying to eliminate desflurane in many parallel ways throughout our own, through our own professional bodies like Ontario's anesthesiologists. And I know in Alberta, they have a sustainability officer, and there's many anesthesiologists working towards that goal. Same as BC, they're actually working through their health authorities to get rid of desflurane. But what we need is a approach to actually ban it. And there's different ways to effectively ban it. Sanjiv and I did actually look at it, whether there was a legal route, and that seemed to be long and arduous. So probably the most efficient way would be to put carbon pricing on it. And the use of desflurane is actually very regional. And I think you would agree with this, Sanjiv. There are pockets where they use a lot in Canada and areas where they use none. And in order to make it uniform, we can't rely on individual health centers to do that, to be efficient. I do think CCL has the best approach, and that's really to work with the politicians to improve regulation.
Yes, we have another question from in-house. And while he's coming up, I'll just mention that as Dr. Rao mentioned, when we spoke to politicians in climate change in Ontario office, they basically told us that just banning desflurane is actually more work and more arduous within the government than putting a carbon price. The process of banning an agent is actually a lot more difficult than we thought. But James has a question.
There we go. Oh, there we go. Okay. Yeah. So thank you for the presentation. And we actually, Nico and Kathy and I are a little bit familiar with that because we presented it to our member of parliament in Montreal a couple of weeks ago. And Dr. Rao, you mentioned it kind of varies by region how prevalent the use of desflurane is. And I'm wondering, like, are there any provinces where they're not using it at all, or they're using a lot of it? And really, the reason why I ask is, in Ontario, it's the federal pollution pricing system in place. In Quebec, we have our own system. In BC and Nova Scotia, they have their own system. Does it make sense for us to be taking this lobbying ask to BC and Quebec provinces, or is it like phased out?
Thanks, James. I think it is meaningful to do it on a federal level. So we spoke to several provincial politicians, and we did speak to the Environment Commissioner of Parks and Recreation in Ontario, and they were very interested, but they kept saying the GHG inventory is federal, while healthcare is provincial, but getting it into the GHG inventory would make sense federally. For Ontario anyway. I understand other provinces have their own and Quebec has their own. However, if one place does it, the rest will follow. And I think that's what's important to know. And if we get it into the federal GHG inventory, then those provinces that have their own carbon pricing system will follow. It is somewhat regional. And for the first part of your question, BC uses very little. And that's probably partly cultural, right? They're ahead of the curve in many ways. And their residents are actually, they're taught not to use it. And I think more and more in the academic centers across Canada, the younger people don't use it. It's really, there was a certain generation that used it a lot. And I'm just going to answer the question in the chat at the same time about if there's any relation to patients' health and switching away from desflurane. No, there's actually zero benefit from the patient to use desflurane instead of sevoflurane. In fact, desflurane cannot be used for certain classes of patients with heart disease and for pediatric patients. It's really a matter of what people are used to, and some people will switch once they learn about the environmental degradation of desflurane, and others are not invested in the environment and won't switch. So I hope I answered both of your questions, James. Let me.
And James, right beside me, so it seems weird to talk in a microphone, but I've given talks as Anita has, all across the country. And I'd say in every province, there are pockets that are quite significant. But I went to the Montreal General Hospital and I gave a talk. There was a huge use of desflurane in particular at that time. It was a cultural milieu of that hospital. There was a time when they marketed themselves as allowing for people to have a faster wake up. in particularly elderly patients. So therefore they felt it was an advantage. That has not been shown clinically, but they did a good job marketing themselves. And, so people used it. They said, oh, they convinced themselves possibly that did work. So it's also partly overcoming that. We had that in Sudbury too. There were several people who were absolutely adamant against it. But then, when we published how much money the hospital was going to save and the carbon footprint, it was almost taken out of their hands. And I think that's what carbon pricing will do. It will take it out of their hands. It won't even be brought into the hospital. Some people worry about what happens if you get rid of desflurane and then sevoflurane manufacturers collapse and all of a sudden we have none. So there has been 1 or 2 places that have decided to keep desflurane not in the operating room, but in a storage somewhere in case we ever run out of sevoflurane. To counteract that, I always tell people sevoflurane has never had an issue with delivering their medication. It's made by 2 major companies, both Baxter and AbbVie. So if you get asked by your MP, if they have 4 plants around the world versus desflurane, which only has 1 plant, and that plant is in an area that is frequently hit by storms, actually. So actually, sevoflurane is safer from a hospital's perspective in terms of its ability to get you the drug, because in the end, you still have to use a drug. And I think Anita brought up a great thing that the NHS doesn't even use it. It doesn't even use desflurane. So it's certainly we have a precedent when the government says, well, we don't want to get involved with healthcare. My answer to that is that the whole NHS system doesn't use it. It clearly doesn't need to be used. Okay, thank you, Bill. Anita, do you want to answer more from the chat?
Sure. So the Mr. Cullen has asked, could it be lumped into the GHG inventory with others to expedite the process? So initially, when we started on this, we actually thought we should do that. And I had a very good conversation with Dr. Diane Sachs, who's a very well-known environmental lawyer and the former environmental commissioner for Ontario. And her advice was, no, it gets a bit complicated. And probably partly because it's healthcare, partly because it's hard to define what the whole health system is. And there's only carbon pricing if you reach a certain threshold of emissions. So what do we use? Do we use just one hospital? Do we use a whole province? So she felt that it should be in its own section and not with the other hydrofluorocarbons. And that was her advice. And so far, I've not heard any MP say to the contrary, but regardless, I agree with Sanjiv. I think this is almost theoretical. Once we say that we put a carbon price on it, it just will not be procured by any of the procuring agencies. It just won't be allowed to be used. It will be too expensive in our healthcare system. The other question, would CAPE or CMA be able to help? We're working with them already. We've actually gone quite far with other organizations. Right now, we want to get that last 12% of desflurane out of Canada. Has this been taken to the Canadian Anesthesia Society? Dr. Mathur's he's actually part of the environmental executive of the CAS, and they have already put out their position statement along with a group of other anesthesiology countries, actually New Zealand and Australia, in the common, it's called a common, what is it called exactly, Sanjiv? It's called the Common Issues Group. They've already put out a position statement saying we should not be using this medication.
Kathy has a question for you.
Hi, Anita.
Kathy?
Yeah, it's so nice to see you. Okay, so I understand the global warming potential data that you give is the 100-year global warming potential.
Yes, it is.
Yes, can you blow everybody's mind and scare them a little bit when they put it down to the short-term potentials, like what it means in the next 2 or 3 years? Because it is really powerful stuff.
It is. And I don't know those numbers off by heart. I think for desflurane, it's 8,000 for 1 year. Yeah, and for 20 years, it's well over 3,000. And it lasts in the atmosphere for 14 years, where sevoflurane lasts in the atmosphere for only 1 year. So it's actually, do you know the exact global warming potential for DES for 20? I think it's 3540.
Yeah.
It's very high. You're right. And maybe I should change that, Kathy, on my slides. That is the 100-year global warming potential I have there.
Yeah, what exactly does 8,000 mean and 32 sound like?
Oh, sure.
Yeah, we're super geeky. We got to help everybody here.
Okay, so 1 gram of desflurane in 1 year exerts the same effect as 8,000 grams or 8 kilograms of CO2. So the number is just the number by weight times how much global warming potential, which is the same as carbon dioxide equivalents. So 1 gram, barely something you could feel in your hand, is the same as 8 kilograms of CO2.
Did you want to do a few more questions? I know you have something else to do, Anita.
No, I'm just looking at this chat question. In the current leave behind for lobbying, one of our asks is, does the need to be updated so that the ends are accounted for in a different way? I think the ask should just be, we should count desflurane and all anesthetic gases. Truly, we should be counting all scope 1, scope 2, and scope 3 emissions from healthcare into the greenhouse gas inventory. Right now, it's only energy that's counted. And I think what we've learned, I believe, is that often they don't know how to count desflurane. This is the easiest win for any government, is really just to say, look, there's about 300 anesthesiologists around the country who use desflurane regularly, and we're saying to them, you just can't use it anymore. It's almost an issue of getting the environment ministry and the Ministry for Health together to work together to actually create a regulation for this. So I would just lobby to say we need to count these, and we need to make our health professionals accountable to the way they administer their profession, and leave it up to the MPs to decide how to do that. And usually they would come to one of our organizations like the CMA or the Canadian Anesthesia Society to do that. Did that answer your question, Anne? I'm not sure. You can chat me back. Okay.
That's a great lead into our next ask, of course, and that is, we have a letter to your MP that's available on the CCL website, and we'll put it in the chat too, and as many people as you can get to sign, that would be amazing. Anita and I took this to, as she mentioned, I worked with this Canadian Anesthesia Society Environmental Sustainability division. It's an official division now, which was a big get actually. And they're going to send it to every member who's anesthetists also, once they clear 1 or 2 hurdles. So we've got their support too. But in the end, there's still going to be, to be honest, some people utilizing this gas. I think long-term, if we get a price on this, get rid of it, other countries will follow. I just want to add just 1 or 2 points too. If you take an operating room that uses desflurane and you measure all the energy used in energy, electricity, heating the water, if you measure all the energy used for delivering equipment to that operating room and waste management of getting rid of it and all that, if you use desflurane, it blows all that away. So desflurane's carbon footprint is higher than all those components. So even though how somebody say, oh, we should take care of recycling, getting rid of desflurane would do more than anything else in the operating room. And there was a phenomenal paper in the Lancet that just actually looked at hospitals. And the hospitals that don't use desflurane have a tremendous drop in their carbon footprint. And I think that's a point I wanted to make. And any further questions for Anita? Or Anita, do you want to answer anything else on the chat?
I think I just want to bring out 1 point too, is desflurane is really only used in high resource countries. And again, this is an issue of climate injustice, is that we use this medication that's really inaccessible for low resource countries, yet we are again putting them at risk. And I think that's an important point that I like to make when we speak to MPs, is again, the injustice of it all. And I know that's important to everybody at CCL. So because that wasn't immediately obvious in my slide, it's really only European countries and in North America that have the amount of money to pay for it, really. And that's it. Thank you so much for allowing me to speak today.
That was amazing, Anita. And to follow up on her point, they've actually measured the stuff in the atmosphere. This is not all theoretical calculations. By putting up balloons up in the atmosphere in 4 different locations, over a full year, they measured the volatile anesthetics that were captured. They then calculated the carbon footprint. And what is sad is 80% of that carbon footprint came from desfrane, even though it's only being used by wealthier countries. So again, it's the privileged who are pretty well polluting more than the others. Thank you so much, Anita. That was really, really amazing. And we can, of course, ask people again, once again, to assign your letter to the MP. That's going to be in the chat, or give it to other people you know, spread that around. That'd be great. Thank you very much. I'll see you in 15 minutes.